particularly between, I would suggest, August and January. They're particularly September and October. And the minister, I'm sure, has the same level of concerns and complaints coming in. Some of them are valid, some of them are, somewhat technical in nature because forms haven't been properly filled out, or the parents haven't provided the sufficient detail or whatever. But it's becoming so bureaucratic and so cumbersome, Madam Speaker, that it's almost like the faint hope clause to get to the higher appeals division of the student aid. And when you do when you do get there, the likelihood of having your appeal successful is very, very slim. It's very slim. So how can a student concentrate on their university education when they're going around with a migraine headache wondering if they're going to have enough money to be able to pay for that course, wondering if they have enough money to buy that book that they're advised by their professor to purchase if they want to enroll in that course, or all the lab equipment, or all the extras that are required. All these hidden costs, Madam Speaker. They can't be worrying about all those matters. If you want them to do a job and do it well, they should be focusing on what they're sent there to do, and that's to get the best possible education and put 150% in and mature, enjoy life, and do the best they can in a wholesome environment. How fair is it to all these students that go around wondering, in a complete mental stress situation, wondering if they'll have enough money to be able to get in to the second semester of their university or their community college program? At some point, Madam Speaker, we as legislators have to change our thinking on this. And my plea to the Minister of Education is that he make this appeal to his colleagues. Change the thinking that university education is a cost to government. It's a cost to the system. Is your glass half empty or is it half full? Madam Speaker, you can think positive or you can think negative. It's easy to criticize, and I'm sure it's easy for myself as an opposition MLA to point out all the errors and omissions and all the weaknesses in the system. I know it's very difficult as a minister of the Crown. I know it's very difficult as a government to address these policy issues. But good heavens above, if the youth of this province are everything that the government says it is, we know in rural Nova Scotia that the youth are leaving in record numbers. The Minister of Energy knows himself on Cape Breton Island, we are losing in excess of 450 young students a year for the last 15 years. And yes, under different governments. And Madam Speaker, it gets even more concerning when you hear policy questions raised about the government limiting or designating universities in this province. And for those who aren't familiar in what university designation means, this is a study that's been undertaken by the federal and provincial governments right across Canada. And if it's enacted the way it was proposed, then we would see a dramatic downturn in the student population at the University College of Cape Breton and possibly other universities, particularly in rural Nova Scotia, whether it be at the University St. Anne, whether it be at Acadia University, or what have you. Those universities that have students that come from economically hard-hit areas are the universities that will feel the impact the most. And I'm afraid that if the government, with the cooperation, and perhaps it requires some input and some direction from not only the Council of University Presidents in the province of Nova Scotia, but also from the Higher Education Commission to address this very serious issue. Because we know that it's going to be a budgetary matter for the province of Nova Scotia. And if it's a way to cut cost, then obviously the government is in a very unique situation as to what its options are. So I put those points on the table, Madam Speaker, and I would ask, perhaps I wouldn't expect the Minister to comment on those because they're broad-based issues. They do relate in some way indirectly to the bill and in many ways directly to the issue there. The Minister also knows full well my feeling about the importance of university education in an uninterrupted state. We've had labour disruptions in this province at a more frequent basis than we've ever seen before. We've had several strikes at Dalhousie University. I've had numerous calls, Madam Speaker, about parents that were so upset that their students, after pouring out $10,000 to $12,000, wasn't getting the quality university education that they were promised. You know, some supplemental offerings were made at a later date. Whether that fulfilled the issue with the university students or their parents, that remains open for question. You know, we saw the labour issue at Acadia University. University education, and of course it's my own feeling, Madam Speaker, is that university education is essential. It's essential to the long-term prosperity of this province. And at some point, we have to deal with that in some way that satisfies all the stakeholders. But most importantly, the students. Because if we keep chipping and cutting at the students' ability to access post-secondary studies, then we are the ones that will pay the price. I've heard students, rightfully or wrongfully, make the comment that why should we be worried about the long-term health cost for seniors? You know, we have all these politicians and all these people that have gone before us, and what have they done for us? They put us in a position where we're going to be bankrupt for the next 20 years ourselves, and we can't even afford to raise a family. You know, so these are public policy questions that we have to think about what the young people of this province are saying. Whether they're real or whether they're apparent or what have you. But they're being asked more and more often than they ever were before, Madam Speaker. And I would hope that the Higher Education Commission, in some way, perhaps it may require an amendment to this Act. I don't know. It'd be interesting to hear all the presentations come forth. But I would be interested to hear some of the thoughts from the Higher Education Commission on some of these broad-based issues, whether that falls within the confines of their mandate or not, because ultimately it's all about education. And we all know one thing, Madam Speaker, education is no burden. Thank you.
The Honourable Minister of Education.
Thank you, Madam Speaker. I'm pleased to rise to close debate on this bill, and I'd like to thank my colleagues for their interventions. I'm pleased that both of the opposition parties, Madam Speaker, will be supporting this going through to law amendments. And to say it's a piece of legislation that has been probably too long in the making, simply because it did come to the House. This, I believe, is the third time it's reached the floor, and just from hearing my colleagues from the Liberal and the New Democratic Party speak, we agree on how important that higher education is, and that it should be a priority of this government, and obviously we support that. So I'm grateful, and I thank them for intervention. Now would like to see this bill move on to law amendments.
The motion is for second reading of Bill 115. Is the host ready for the question? Would all those in favor of the motion say aye? Aye. Contrary-minded, nay. Motion carried.
Bill number 115, an act respecting the Maritime Provinces Higher Education Commission.
Ordered that this bill be referred to Committee on Law Amendments. The Honourable Government House Leader.
Yes, Madam Speaker. Would you please call Bill number 109, the Mental Health Act?
Call Bill 109, the Honourable Minister of Health.
Thank you very much, Madam Speaker. Madam Speaker, the government is committed to developing a better, more responsive mental health system. The first step in this process was developing mental health standards, which form the strategic direction for mental health reform for the next 5 to 10 years. Another key building block in attaining mental health reform in Nova Scotia is the mental health legislation that is now before us. Madam Speaker, this new legislation was created after careful review of the current provincial legislation, acts in other provinces, and in-depth consultation with legal experts, mental health experts, and mental health advocates and consumers. I would particularly like to thank the Law Reform Commission of Nova Scotia for its work in reviewing the mental health provisions in the Hospitals Act of Nova Scotia. The Commission's 2002 report was invaluable in developing the new legislation. Mr. Speaker, we know that mental illness is treatable, and we recognize that people need to have a say in their treatment. And in Nova Scotia, as in other provinces, that is what happens. Most people with mental illness voluntarily seek out medical advice and make their own treatment decisions. However, Madam Speaker, there are times when a small number of people with a mental disorder require treatment but lack the capacity to determine that need themselves. When this happens, it is important that we intervene on their behalf so that they get the treatment they need when they need it. This new mental health legislation, Madam Speaker, is about making sure that when we need to intervene in someone's life, it is done in the least restrictive way possible without unduly infringing on individual rights and liberties. Right now, legislation governing involuntary admission and treatment for mental health disorders is embedded in the Hospitals Act of Nova Scotia and predates the Canadian Charter of Rights and Freedoms. Madam Speaker, this act was established close to 30 years ago, and much has changed in both the type of services and treatments available and the way in which they are delivered. For instance, advances in mental health treatment have led to expanded community-based treatment, more effective medications, over 50 community mental health clinics throughout the province, and inpatient beds for mental health patients being integrated into hospitals within district health authorities and the IWK. Madam Speaker, as you can see, our advances in mental health take us away from having one provincial institution to provide psychiatric treatment, as is the case under the Hospitals Act. Instead, we are building a system where those with a mental disorder can access treatment as they would other health care, allowing patients to be treated closer to home. Madam Speaker, our current legislation is outdated and not reflective of modern clinical and legal practices. The new standalone mental health legislation will update our laws, making them consistent with legislation in many provinces across the country. Our partnership with legal experts, mental health experts, and mental health advocates and consumers made one thing very clear. Any intervention needs to be carried out in a way that respects and values individuals' civil rights and liberties. The new Act does just that. It contains guiding principles to help mental health practitioners and consumers find that balance. The new act is more specific about guidelines used to determine a person's capacity to make decisions, including consent to treatment. Madam Speaker, when someone is temporarily unable to make their own treatment decisions, a substitute decision maker will be involved in all decisions for that person in order to best represent the person's wishes. Leave certificates and community treatment orders are also being introduced in this act. Leave certificates support patients move from hospital to the community by helping them reintegrate into the community in a planned way. Community treatment orders will help those who have a history and pattern of involuntary admission and will be available when assertive community treatment teams are in place. For those Nova Scotians, Madam Speaker, community treatment orders will help them maintain wellness and stability. These orders will also assist in early detection of recurring illness, thereby resulting in shorter hospital stays. Community treatment orders have strict criteria to make sure the intervention is done in the least restrictive way possible. We're confident that the approach is the right approach. However, Madam Speaker, we recognize that the use of community treatment orders will not be wholly supported by all mental health experts, advocates, and consumers. To acknowledge this, we have built into the new legislation a mandatory review of these orders after 5 years. The Act also requires that the findings of that review be tabled in the House of Assembly. This review provides a way in which evidence-based research can be considered to determine if any legislative amendments are necessary. The new Act also introduces independent rights advisors. These advisors will operate at arm's length from government and the district health authorities and the IWK, and will be involved with those who are involuntarily admitted, placed on a leave certificate or a community treatment order. The independent rights advisors make sure that these patients are aware of their rights. The Act also changes current involuntary admission criteria to be more in line with other provinces and reduces the time period in which involuntary psychiatric assessments must take place from 7 days to 72 hours. Madam Speaker, I'm sure that all will agree that the treatment needs of every Nova Scotian are important. Most people have the ability to make their own treatment decisions. The mental health legislation that I have introduced in this House speaks to those who cannot. Madam Speaker, I'm very pleased to move that this bill be now read for the second time. Thank you.
The honourable member from Halifax Needham.
Thank you very much, Mr. Speaker, or Madam Speaker. I'm pleased to have an opportunity to rise in my place this evening to enter into the debate on the Mental Health Act as introduced by the Minister. Mr. Speaker, when this, or Madam Speaker, when this bill was first introduced into the legislature, I was generally of the view that it was an important piece of legislation whose time has come, and not having had an opportunity to really examine closely the legislation, I still think this is a very important piece of legislation. However, Madam Speaker, I am very concerned about the tenor and the approach of much of this legislation, and so I guess we'll have an opportunity to talk about some of the fundamental problems in this legislation. Madam Speaker, there has been little other legislation that I've ever seen in my time here in the legislature with respect to health that is so substantial a piece of legislation with such broad implications for people in our province than this piece of legislation. This legislation is complex, and in it contain issues of an ethical and a legal nature. And as the minister indicates, this legislation essentially speaks to the issue of the involuntary treatment of those in our province who have mental illnesses. This is a piece of legislation that requires a mental health plan before we have a mental health act. The minister spoke about the work that has been done prior to the introduction of this legislation, work that sets out some standards, mental health standards. And while that's very important work and very welcome work, with all due respect to the minister, we do not have a comprehensive mental health plan. And when I look at this bill and I see a broadening of the powers for the mental health practitioners that will, in fact, bring more people into the mental health system than is currently the case, without a plan or the resources to operationalize the plan, I think, how in the world can a mental health system that is already suffering the pressures of inadequate resources to deal with the current population ever going to be able to manage a broadened definition of mental disorder, a new set of criteria for treatment, not only inside mental health facilities, but now in the community on two different levels. One, when involuntary patients are returned to the community on leave with a bunch of provisions that will need to be policed or enforced. And additionally, mental health consumers in the community who will now be subjected to a new feature of the mental health system called community treatment orders that require community treatment plans and not only the resources to carry out those plans, but the resources to supervise and evaluate and oversee those plans. And Mr. Speaker, this is a substantial substantial increase in the amount of work that we are now heaping on to our district health authorities and our mental health providers across the province without, I would submit, Madam Speaker, a comprehensive plan and any allocation of resources to carry this out. Madam Speaker, I want to move back a bit before I discuss some of the concerns I have more specifically around this, this piece of legislation. I want to stand back a bit to just the work we do every day as members of the legislature. You know, as MLAs, I don't know about other people's caseloads, but I would guess if my caseload as an MLA is anything like other members of this legislature, the vast majority of people we see sometimes are people who are connected to the mental health system. And I see you nodding your head, Madam Speaker. I'm sure you see many people in the mental health system. I have had in the time that I've been a member of this legislature, people whose lives have been so intolerable in the community, in substandard housing, without employment, without opportunities to upgrade, with inadequate income, without the ability to get transportation to the day hospital programs or the self-help groups. I have had members of my constituency with a history of mental illness come and beg me to help them get into hospital, where they would have a warm bed, they would have 3 square meals, and they would have some security for a period of time. I have had, as an MLA, in just the last few weeks, calls from people who are in facilities, in mental health facilities, who want to get out into the community and are looking for advice on how to proceed, whether or not they have any rights with respect to determining their own treatment. And we've all, I think, had calls from families in our community, with family members, with children, with adolescents, with a spouse, with a parent, with adult children, with mental illnesses, who are unable to get services, who are on waiting lists for assessments, or in some cases who have been in the mental health system and are back in the community without any of the supports that are required to have them be able to manage their mental illness. And as that spiral of becoming sick starts to occur because of the situations these folks are in, they may stop taking their medication, they may start spiraling out of control, and their family members, quite rightly are distraught, absolutely distraught. And they're desperate to find someone who will help them get the services and help them make sure that their loved ones, their family members, are in fact safe and get health care services. And I think we've all probably had calls from small options homes in our communities. I've certainly had calls from small options homes or from residents who live beside small options homes who are very upset that there are such things in our community. There continues to be, I think, an attitude on the part of some members of our community, sadly, that would prefer to see people with mental illnesses not in our community. It makes some people very, very uncomfortable, and they complain, and they would prefer to see people institutionalized and moved out of the area. And that can be a very hard situation to deal with. I had a small options home where one of the residents, in addition to the mental illness this person had, was epileptic, and often 911 would be called, and the fire department would come, and the police would come, and the residents in the area found that very disruptive. It's a very quiet residential neighborhood, and they really wanted this small options home moved out of the constituency or the area. They didn't like the fact that some of the residents in the small options home might go door to door, knocking on doors, asking for, bumming cigarettes. Do you have a smoke? Can I use your telephone? Or just trying to make friends. But, one of the things that's occurred to me around the small options homes we've set up is the absolute inadequate amount of resources we give to the operators of these homes to provide staff supervision to people. When I taught at the Maritime School of Social Work, I would say a good third of the students I had in my classes worked as casual employees in the small options sector. They made slightly more than minimum wage, and they had to be in these small options homes at night, essentially, and early in the morning to make sure that the residents, got up and had a bite to eat and at nighttime went to bed and what have you. And the amount of supervision and support that people actually got in those small options homes sometimes left a lot to be desired. And this isn't to say that small options homes are a bad thing. I mean, I think they're actually a very good thing. Supervised apartments, small settings, but we haven't really treated these organizations well in terms of really being able to provide a home-like environment that will adequately support people with mental illnesses in these homes. And the challenges of many of the small options operators has been enormous. It has been enormous. As an MLA, I've had occasion to talk with police who are in our community trying to deal with a growing number of people with mental illnesses who are in the community as a result of the closing of hospital beds. Madam Speaker, in this province, we had 900 psychiatric beds at one time. We now have roughly 200, and that includes the psych beds for kids. That's not a lot of in-hospital capacity. Now, does that mean the number of people with mental illnesses has dropped? No. So where are they? They're in our community. They're in our community. And when the deinstitutionalization went on, what were people in this province told, and what were members of the community told? They were told that the resources would follow the mental health patients into the community. And Madam Speaker, this has not happened. This is a very serious problem. And now we have a piece of legislation that acts as if there are resources, and there will be resources in the community in order to operationalize this piece of legislation. And it's very, very difficult to trust that that's going to be the case based on the behavior of the government to date. Madam Speaker, I think it was this morning on Information Morning, Carol Touton, who's the Executive Director of the Canadian Mental Health Association, called in response to an interview that had been done in the last few days. And one of the things she said was that roughly 4% of the health budget in this province is allocated for mental health. That situation has got to stop. It has to change. And what we have here is a bill that really does nothing to address this problem. You know, 1 in 5 Nova Scotians will suffer from a mental illness in our lifetime. And in fact, you know, probably if we look around this chamber, there are members here who will have suffered depression. We have family members who have had mental illnesses. We have friends. So we all know people in this situation. So the mental health system the mental health system has a lot of implications, and how well that system is resourced has a lot of implications for many, many members of our province. Now, the minister talks about the controversial aspects of this legislation, and I would like to get into some of the specifics of the legislation. I think we need to start and look at the definition of mental disorder in this act. Madam Speaker, that definition has been broadened in this legislation. It has been broadened to include memory. Let me read the definition. Mental disorder means a substantial disorder of behavior, thought, mood, perception, orientation, or memory that severely impairs judgment, behavior, capacity to recognize reality, or the ability to meet the ordinary demands of life in respect of which psychiatric treatment is available. Madam Speaker, in our province today, there are a growing number of seniors who suffer from Alzheimer's and dementia. This is a disease, this is an illness that has a profound impact on people's memory. Now, in my discussions with people about this legislation, one of the things that has been raised, one of the issues that has been raised with me is the implications of broadening the definition of mental disorder and including memory as a piece of this, and what this means. Does this mean that we will institutionalize in our acute care psychiatric facilities seniors with Alzheimer's and dementia who pose in the opinion of a psychiatrist some danger to themselves or others? They're exhibiting violence, which we know can be a feature of having Alzheimer's. And once we start occupying those limited number of acute care beds around the province for people with psychiatric problems by this growing number of senior citizens in our province, then what happens to people with mental illnesses who need to get into psychiatric beds around the province? Will this create a pressure to open in the districts around the province more long-term care beds, specifically mental health long-term care beds for patients, for patients? I mean, one of the things that we have no idea about in terms of broadening the definitions and broadening the range of treatment options that are contained in this bill is what kind of pressure is this going to put on district health authorities around the province? And are they going to be able to meet those needs? And Madam Speaker, what I started off by saying is the current system is unable to deal with the mental health demands that it has. We have depleted so much of the capacity in our system. How in the world is this going to be accommodated? These new expanded definitions that clearly are going to result in increased demand and the need for more capacity in our healthcare system. So this clearly is a problem. I started off by saying, Madam Speaker, that when I was first briefed on this bill, and when I first had a look at it, in the beginning it seemed to be not so bad. And I should make absolutely clear, Madam Chair, that I think it is long overdue that we have a Mental Health Act in this province, a standalone Mental Health Act. But whether this is the Mental Health Act we should have, I am not so sure. When I look at the voluntary admission piece of this legislation, I wonder what's so voluntary about treatment. There are some fundamental violations of the rights of patients. The voluntary patient who goes to a psychiatrist and presents themselves as needing psychiatric assessment and treatment. I go to a psychiatrist and say, I really feel like I'm not well. I would like you to do an assessment and tell me what my treatment options are, and I'm prepared to go into a facility. At the end of that process, the person who does that and is admitted to a facility as an inpatient on a voluntary basis, according to this legislation, will not be able to leave even as a voluntary patient if a member of the treatment team thinks they should be restrained and detained. Now, I don't know how that can possibly be perceived as a voluntary admission in any stretch of the word. So in short, Madam Speaker, what I'm saying is this act takes enormous liberties with people who require mental health services. And it takes these liberties by taking away their liberty in a way that I think is simply too harsh and too extreme. And in many respects, Madam Speaker, this represents a fundamental shift in mental health law. In talking to people about this bill, and I haven't had a lot of time to do that. I'm not going to stand here and whine about that too much, Madam Speaker, but I will mention that for such a substantial and fundamental piece of legislation, the opportunity to really consult and to hear from members of the public and people on the front lines has been quite limited. But I have had an opportunity to talk to enough people who participated through the consultation process to know that there are significant concerns being expressed to me about the provisions in this bill. One person said to me that virtually every coercive technique that is available is embedded in this legislation. And that, in fact, the current test in our legislation that's 30 years old, that predates the Charter of Rights and Freedoms, that you have to be an actual danger to yourself or others, is not the test in this legislation whatsoever. And that a person can be presumed to be in need of assessment and intervention if they're likely to suffer impending serious physical impairment or impending serious mental deterioration, and that bar is just too low. And so there are people who are expressing some concern about the lowering of the bar in this legislation to the point where to the point where the rights of individuals have the real potential to be trampled on, Mr. Speaker. Now, I think one of the things that people need to know is the process that has occurred to get us to this place. And I want to say to the minister that I see this legislation as a missed opportunity, I suppose, in some ways. The government had a discussion paper that they posted on the website, and they alerted the public to around the 18th of March, I believe it was, in this year. And they asked for a response to their discussion paper by the 30th of April. And I understand that they had about 50 submissions, written submissions, and they probably had some perhaps other submissions that weren't in writing. And following that very limited consultation process, nothing else really occurred. People didn't see a draft piece of legislation. There wasn't a synthesis. There wasn't a follow-up in terms of providing various viewpoints. And in this situation, like in most consultations, you're not going to get a uniform response, Madam Chair. You're going to get people who have a lot of different ideas, and you're going to get people who want way more restrictive legislation and people who want less restrictive legislation. And there's going to be a lot of different ideas come forward. And I'm sure that was the case here. And then the challenge for any working group, or in fact the officials in the minister's department, is to find a coherent path that they can put forward that will make sense. But sometimes, Mr. Speaker, it's important, or Madam Speaker, it's important really to not be too hasty in what it is you're bringing forward, and especially when you have very different ideas, and especially when what you're going to bring forward is so significant and what you're bringing forward is going to be so controversial. I talked about the broadening of the definition of a mental disorder. I've talked about the voluntary admission piece of this legislation having a very significant clause that absolutely nullifies the voluntary nature of a person coming into the mental health system. And Mr. Speaker, or Madam Speaker, those aren't the worst pieces of this legislation in many respects. This legislation then provides a test. It lowers the bar in terms of the admission on an involuntary basis into a mental health facility. And it also then establishes two fairly controversial mechanisms for the ongoing involvement of the mental health system with the involuntary patient. And that is a provision, the provisions in this act that provide for certificates of leave. So, for example, an involuntary patient can be discharged from a mental health facility into the community and on a certificate of leave, and the certificate of leave will lay out a whole bunch of requirements for that patient to go to appointments, to comply with the treatment orders of the psychiatrist, et cetera, et cetera, et cetera. This is a new feature of how we are going to deal with people with mental illnesses in Nova Scotia. Now, some people would say, you know, well, what's wrong with that? What's wrong with setting out some criteria to a mental health patient that says you've got to go to your doctor's appointments, you've got to take your medication, you have to do these things? And I think that the answer to that is that as much as we would like to be able to just dispense with the rights of people and say, this is what you have to do, there are a whole lot of things we have to weigh when we look at proceeding in this way. You know, we have to ask, how long can people be kept on these certificates of leave? What happens when a patient fails to make an appointment? What are we going to do to provide resources to make sure that a patient can get to an appointment? You know, where are the resources to make sure that that person isn't living in the Cockroach Hotel and was up at 4 o'clock in the morning because there was, you know, a drunken brawl going on, and that's why they didn't get to their appointment. And these provisions have us sending the police or a sheriff or a peace officer, whoever a peace officer is, however that's defined in another piece of legislation, out to pick these folks up if they violate their certificate of leave. It's a very, very coercive mechanism. And it's a new piece of coercion in a mental health system where we have to ask, to what extent do we want a coercive mental health system? Is that how we want to deal with people with mental illnesses in our province? Do we want to deal with people with mental illnesses in this province in a coercive fashion? And, Madam Speaker, all I can say is that I don't want to deal with people in a coercive fashion unless it's absolutely essential and unless we build in so many protections to ensure that the rights of those people are not violated and that we, in fact, have met our obligations as a community to first provide them with adequate supports and services so that we're absolutely clear that it's not because they've been abandoned out there in the community without the adequate supports. Now, there's another question we have to ask ourselves around establishing a new mechanism like this, a certificate of leave. You put certificate of leaves in place, you automatically have to have the resources to enforce those certificates. And you also end up in a situation where the possibility that those folks on certificates of leave are the people who are going to draw the attention of the healthcare providers, because they have, there's now a new legal entity. There's a new legal entity. And as a practitioner, you would dare not follow through on your responsibility to make sure that people are following what's in that certificate of leave.
Order. I believe the Minister of Health might be having a hard time hearing the honourable member.
Thank you, Madam Speaker. So there are some people who are very concerned, and it's a valid concern that the attention will go to a particular group that are on certificates of leave, and it will leave other people who aren't on certificates of leave who equally require mental health intervention and support and professional treatment untended to. Certificates of leave aren't the only problem in terms of expanding the powers of the mental health system to follow people around in the community. The minister made reference to the controversial aspect of this bill called community treatment orders. And here too, we have another mechanism for enforcing or policing the treatment of people with mental health, with a mental health diagnosis in the community. And while this provision makes reference to the services that people require in order to be in the community, and that these services have to exist and they have to be provided, we all know that those services aren't there. They're not there for the people who are already deinstitutionalized in the community. They simply are not there. And so here we have government saying, we're going to extend further into the community the ability of the medical profession to order treatment in the community. However, we see no commitment of resources and no idea of what's going to be provided, except we already know what's not being provided. And the things that aren't being provided are housing. We're not providing employment opportunities and training. We're not providing a whole variety of supports. We're not providing adequate supervision and support in some of the small options homes that we have. So, this is a very serious problem with this legislation. Now, I know that the minister has said in his presentation that one of the ways that the government is going to deal with the fact that they are expanding and extending the control over persons with mental health is they're going to offer people with mental health what is being called in this legislation a patient advisor. But I want to tell you that it doesn't make any difference if you have 100 patient advisors. I can walk up to a person with a mental illness and I can advise that person that they have certain rights. But if they have no way to actually get an advocate that can represent them through a very, very complex system of reviews and appeals, then their rights are meaningless. It's like saying to people on social assistance, you have the right of appeal. Yeah, right. Yeah, people have the right of appeal. You ever call up a legal aid office and say, I have a social assistance appeal next Thursday morning. I need somebody who understands the act and the regulations to come represent me? And what happens? There's nobody who does this work. There is nobody in our legal aid offices who does this kind of work anymore. It's practically impossible to get legal representation unless you can pay for it. And an awful lot of people in our mental health system are not able to pay for legal representation to make sure they have their rights protected. So you can advise people all you want that they, under this legislation, you have rights. But you try to get those rights enforced, that's not going to happen. There is no guarantee in this bill that people will actually be able to enforce their rights. Madam Chair, I haven't had an opportunity, I haven't had enough time to look at legislation across the country, but I do know one thing, and I know that the Manitoba Mental Health Act does in fact give mental health patients a mental health advocate that in fact has the ability to represent, not advise that they have rights, but to actually represent and ensure that they have adequate representation through an appeal process. And one would expect nothing less when you're really eliminating so many rights of mental health people in this province.
They didn't get elected standing here, they got elected sitting here.
Madam Speaker, you know, I talked a bit about how complicated this legislation is. The discussion paper from the department that was issued back in March, I guess. It's a very, very interesting discussion paper, I must say. It has extensive footnotes that make reference to research and legislation that was done in many other jurisdictions. And I think for anybody who wants to participate in this debate, this is a good place to start to understand the complexity of these issues. Well, one of the things that I was quite puzzled about is, as I read the discussion paper and looked at the legislation, was that some features of this legislation, in fact, are not mentioned in the discussion paper. And as well, it seemed that some of the ideas that would formulate a more balanced approach to mental health legislation, in fact, in the discussion paper, didn't find their way into the bill. And I'm not really sure why that is, but I would certainly like to hear from the minister more about this process. This bill also has some other features that are worth discussing and raising some concerns about. This bill has a whole section on substitute decision makers. In laying out who will be a substitute decision maker, one of the things that causes some concern to me is the fact that patients themselves are given insufficient control over the choice of people or a person who will end up making treatment determinations. I can tell you, Madam Speaker, that I sure as heck wouldn't want somebody to choose a substitute decision maker on my behalf that I don't agree with. Can you imagine? You have a brother and a sister, your sister who you are very close to and talk with on a regular basis, and maybe a brother who you see on holidays or something like that, but you argue all the time. Not that that's the case in my case, Madam Chair, but let's say that were the case, and the government decides, or through this process, the government decides that it's the brother that will be the substitute decision maker. In some cases, some people's brothers might agree to them having a lobotomy because they might think that that really is what should happen. But, Mr. Speaker, I really think that it's important, and I shouldn't make lightly of what is a very serious matter frankly, is that you want to have the patient involved in identifying and determining, if at all possible, their own substitute decision maker. I mean, imagine doing this with people who had heart disease or cancer. Just imagine deciding, well, we're going to, we have this list of potential substitute decision makers, and we will make the decision. I think we really need to examine this. So, there are many problems with this bill. I look at this legislation and I think, okay, the Hospitals Act in Nova Scotia is like 25, 30 years out of date. The changes in that legislation, in fact, I think, Madam Speaker, when the Hospitals Act was last changed, I think I was a social worker at the Nova Scotia Hospital at the time. I remember when the changes were being made, and I remember this idea that patients would be formal or informal. That's what they were called, not voluntary and involuntary, but formal or informal. And if you were to be an informal patient, you would require the opinion of 2 doctors, one a medical doctor and one a psychiatrist, and that determination would have to be made within 3 days. And if you were found to be, if they decided that you were suffering from a mental illness and you were a danger to yourself or to someone else, you could be held in the mental health facility. Since that time, a lot of things have happened in the field of mental health and in the field of law. We've had the Charter of Rights and Freedoms has become law in this country, and we have had a significant deinstitutionalization of mental health facilities, and we have had a significant cut in healthcare funding across the board, and mental health services have suffered as a result of that. So there isn't anybody, I don't think, who would argue that the old Hospitals Act is adequate to deal with that current reality, the reality of having a Charter of Rights and Freedoms, the reality of having deinstitutionalized mental health system, and the idea that, well, the other feature that really certainly has changed since I worked in the mental health field is the growth in the use of medications to deal with people with mental illnesses. And in fact, the new medications are said to be much more effective, and they create much less problems for people who have to take these medications. So, everybody, I think, can accept that there is a need for a new Mental Health Act that more adequately reflects the current situation. But I want to come back to the question, is this bill the bill that adequately reflects the current situation? Does it adequately protect the charter rights of mental health patients? And I'm seriously doubtful that that is the case in quite a number of ways. Does it adequately recognize the current capacity of the mental health services across the province to be able to implement this piece of legislation? And I have my doubts about that. There are many aspects of this legislation that is going to put greater pressure on the mental health system and a different kind of pressure on the mental health system. And whether we have put the cart ahead of the horse is a real question I have, because the thought I had at the beginning of this debate was whether or not we had an adequate plan. The other aspect of this legislation that I think really has gotten lost is that there is no language, there is no sentiment, there is no philosophy expressed in this legislation about health promotion, prevention, these kinds of things. You know, everybody knows that the social determinants of health have a significant impact on our physical and our mental health. And nowhere does this act talk about this, not even in the preamble. In the preamble, you know, the preamble to this legislation has some guiding principles that I think most of us can look at and say, yeah, those sound great. But do they really go far enough? Do they extend? Do they extend the principle of this particular legislation to the point where they include the ideas of health promotion and prevention? And I think in some respects, therefore, we've missed an opportunity here if we don't take time to get this right. You know, it may be 25 years from now before we see another Mental Health Act in Nova Scotia. And the Mental Health Act, if we were to pass this legislation, will be the legislation that we and people in this province may have to live with for some period of time. So I have to ask the minister, and I have to ask other members of this House, are we prepared to live with this piece of legislation for 25 years, for another 25 years? And given the concerns that I've expressed and some of the issues I've raised, I don't think that I can live with this bill for 25 years. I really don't think this is a piece of legislation that reflects the kind of mental health system that we need in Nova Scotia. A mental health system that is supportive and is proactive, and a mental health system that's not punitive, a mental health system that's not sort of regressive, a mental health system that doesn't remove patients' rights. But having gotten to the point where we've deinstitutionalized so much of our system, why then do we feel the need for such coercive measures in some respects? This concerns me a great deal. I know that there are many, we could go through this bill clause by clause. There are probably many issues that I haven't addressed in this discussion. For example, I have not addressed at all the sections of the bill that talk about appointments to the review board. The review board, as members of this legislature will well know, was the focus of a long and protracted human rights case in front of the Human Rights Commission with Professor Archie Kaiser on one side of the debate and the government of Nova Scotia on the other side. And at the end of the day, there was a human rights settlement agreement, and the settlement agreement laid out certain items that the government agreed that they would adhere to with respect to appointments, specifically around the review board. I don't think, when I look at the legislature, this legislation, that in fact any of those agreements have been embedded in the Mental Health Act. And I would ask the minister to turn his attention to that. And if they're not embedded, perhaps the minister can tell us why they haven't been, why those agreements haven't been embedded in the Act. As I said when I started, Madam Chair, this is a very, very complex piece of legislation. It's probably the most complex piece of legislation I've ever had to sort of go through and analyze, and certainly in the short time I've had, it's been a challenge not being a lawyer. I say that there's very rarely a time when I would want to be a lawyer, but it would not have hurt, I think, at the while I was reading this. The other thing I would say is that the very end of the bill is so confusing for anybody to try to get themselves through, because you really have to be constantly referring to other pieces of legislation. It's frankly unintelligible, and it makes me wonder why this was rushed forward so quickly without having more clarity in this piece of the this part of the legislation. It's not helpful, frankly, as a legislator who really does care about the language and what it is we're doing and whether or not it's accessible and whether or not this is a piece of legislation we can all hold our heads up about at the end of the day when it's so difficult to sort through. So I'm sorry that I took so much of your time, Madam Speaker. Perhaps I took more time than was anticipated, but I really feel that this is such an important piece of legislation that I wanted to speak to the issues that concerned me. And I know that as other members have their opportunity, I'll listen very closely to what it is that they have to say about this legislation, and perhaps I'll have an opportunity to speak again for an hour or so on it. So thank you very much, Ms.
The honourable member from Glace Bay.
Thank you, Madam Speaker. Madam Speaker, let me say at the outset that I certainly listened with a great deal of interest to the member for Halifax Needham on her dissertation, and having listened to her for the past hour, Madam Speaker, I do know and knew that beforehand that she has a great deal of experience on this topic, and as you can tell, a great deal of genuine concern on what's happening with this bill before the legislature, and I congratulate her on her presentation, Madam Speaker. Madam Speaker, it is, as the previous speaker has indicated, a matter of great concern to each and every one of us in this legislature, and I concur with her as well that this perhaps is one of the most important pieces of legislation that has come before this Assembly in at least my time here in the last 6 years or so, and I'm sure in quite some time, because of the nature of exactly what this is going to be dealing with. That's what makes it so important, Madam Speaker. So I'm pleased to rise and to speak on Bill number 109, the Mental Health Act. It's rather timely, Madam Speaker, that this act would be dealt with this week, because today, as a matter of fact, represents the beginning of Mental Health Awareness Week. And there's no better way for us as legislators to recognize the significance of this week than by actually participating in a debate of the Mental Health Act. Madam Speaker, this is the beginning of what has been a rather long and extensive and exhaustive process as well. In 1997, then under a Liberal government, the Law Reform Commission was tasked with the responsibility of making recommendations with respect to mental health and also the necessary legislative changes that were required under the Hospitals Act, Madam Speaker. And in the year 2002, the final report was submitted to this government, Madam Speaker. So I'm pleased, as my caucus is pleased, to see that today we are at least finally debating a standalone piece of legislation that will be entitled the Mental Health Act. Now, it's significant in that it legislates the rights of mental health patients, and it's an important aspect that should not be lost in the deliberation of that bill. Again, as the member for Halifax Needham pointed out, there are many controversial elements of this bill. Madam Speaker, to show you how much it affects each and every one of us, it is a fact that 20% of Canadians will personally experience a mental illness at some point during their lifetime. In our country, the economic cost of mental illness was estimated to be in excess of $14 billion, and that was back in 1998. Madam Speaker, even more costly is the personal cost and suffering to the individual or his or her family and to the community as well. Madam Speaker, there are some communities in rural and remote parts of this province and in our great country that have rates of suicides that are among the highest in the world. Many of those, Madam Speaker, are Aboriginal communities. And a Canadian study found that 2/3 of homeless people using urban shelters suffer from some form of mental illness. Madam Speaker, it's most surprising that of the 10 leading causes of disability in this world, 5 of those are mental disorders. So, Madam Speaker, the way in which we provide health care to those with mental illness is an issue of vital importance, but it's also something that has changed significantly over the past few years. We have developed a healthcare system whereby individuals with mental illness hopefully receive care in the community as opposed to receiving care in institutions. At least that's done whenever possible. And this, Madam Speaker, has enhanced the quality of care for the patient. It has improved the lives of the patient's families as well. But, Madam Speaker, I would suggest that there is still much, much more to do. There are aspects of this bill which are quite positive. But, Madam Speaker, as one would expect, there are aspects of this bill that have the potential to be challenged and are currently being challenged, Madam Speaker, by some of the stakeholders in the industry as well, in the community as well. Bill 109 will specifically lay out the guidelines used to determine a person's capacity to make decisions, and that includes consent to treatment, Madam Speaker. So when someone is temporarily unable to make their own treatment decisions, a substitute decision maker will be involved in all decisions for that person in order to best represent the person's wishes. Now, Madam Speaker, I would suggest that at first blush anyway, that would be a positive move if one looked at it. But again, our previous speaker, and I'm not going to reiterate most of the points that our previous speaker has made, our previous speaker has indicated that there could be problems in that area. This is why this is a piece of legislation I suggest deserves a great deal of thought and a great deal of input before we move ahead too much further with this legislation. Madam Speaker, among the controversial elements of this bill, as again previously mentioned, leave certificates and community treatment orders will be introduced in this act. It is, Madam Speaker, without a doubt, one of the most challenging aspects of this act. Community treatment orders will help those with a history and a pattern of involuntary admission and will be available where assertive community treatment teams are in place. But, Madam Speaker, community treatment orders will only be successful if those community treatment teams actually do exist. Another problem area, Madam Speaker. While this will help Nova Scotians maintaining wellness and stability, we as a caucus recognize that the use of community treatment orders may not be wholly supported by all, and it's a matter of great interest to us as well, Madam Speaker. So we look forward to hearing from advocacy groups and interested parties through the law amendment process, Madam Speaker. And we recognize in this legislation that the mandatory review of these orders, it's after a 5-year period, Madam Speaker, and 5 years, as I was told, is because you need a certain amount of time in order to collect the data that is required. This is a time frame that was suggested by those who were consulted. It could be a positive addition to this legislation. But, Madam Speaker, we have to be certain as legislators that whatever legislation that we pass here is going to achieve the exact objective that it was intended to achieve. And that means that we have to ensure that the rights of those with mental illness are being respected, services and programs in their community are going to be available. Again, Madam Speaker, I indicated during the debate of Bill 107 that a piece of legislation is really only worth the paper that it's written on. If there are insufficient resources available to deliver what is outlined in that act. And Madam Speaker, that has a great deal to do with what's being proposed in this piece of legislation. If those resources aren't there, Madam Speaker, then this act, as I suggested with any other act, is not worth the paper that it's written on. Madam Speaker, community treatment orders will be successful if and only if there are adequate resources to ensure that treatment is available in the community, and assertive community teams are available, Madam Speaker. Let's remember that it was just this past March, Madam Speaker, that the Canadian Mental Health Association gave this province an F for the funding of core mental health standards. An F. Madam Speaker, mental health services currently receive about 3.8% of a $2.1 billion budget. In our opinion, Madam Speaker, that is inadequate. As the Minister indicated in his bill briefing, they're proud of this legislation. But we suggest the pride, Madam Speaker, has to translate into financial support so that the Mental Health Act will ensure that the rights of patients with mental illness are respected in this province. Let me give you an example, Madam Speaker, of how the lack of support by government can impact the lives of those with mental illness and impact them significantly as well. In December of 2003, this government restricted access to one of 3 medications available for patients with schizophrenia and bipolar disorder. It was done in order to contain costs. Government indicated and decided that one drug would not be available for family doctors to prescribe. Only psychiatrists would be able to prescribe after some extensive paperwork was completed and filled out. And this government restricted family physicians from accessing that drug. The only drug, Madam Speaker, that was available to treat bipolar mania was restricted in this province. So patients were left to find a psychiatrist. And Madam Speaker, that's not an easy task in some of our communities of our province. As recent as last year, we held a roundtable discussion across this province on behalf of the Liberal caucus. And one of the major concerns that we held in every community that we went into across this province, from Yarmouth to Sydney, dealt with access on mental health issues. Access to family physicians, access to emergency rooms, access to core health services in this province. Not one community did not experience a problem with accessing help for mental health issues. In this case, Madam Speaker, as I was telling you about, patients were left to find a psychiatrist, and then if they could, get an appointment to get a prescription. So, Madam Speaker, there's an example whereby resources and support in the community were restricted, and who was it that suffered? It was the patient that suffered. That can never happen again, Madam Speaker, in this province. It should not happen, and if it has not already been corrected, it should be corrected immediately. Madam Speaker, this bill introduces independent rights advisors, and those advisors will operate at arm's length from government and the DHAs and will be involved with those who have been voluntarily admitted or placed on a leave certificate or a community treatment order. These individuals make sure that the patients are aware of their rights. Well, again, Madam Speaker, this is positive, but there must be sufficient resources to ensure that we have enough advisors, for instance, to do the job. If not, then again, the rights of mental health patients are compromised. Madam Speaker, I'm not going to go on great length, as a matter of fact, on this. As indicated, there are controversial elements of this bill, such as certificates of leave, community treatment orders, substitute decision makers, and I'm not even going to touch, Madam Speaker, on just the whole issue of adequately protecting the Charter of Rights and the protection of those who are suffering from mental illness and what protection they are guaranteed under the Charter of Rights and Freedoms in our country, Madam Speaker. I acknowledge that the tremendous professional support of key stakeholders and departmental staff as well who are involved in the development and drafting of this piece of legislation. But, Madam Speaker, as an opposition party, as an opposition MLA, our commitment to everyone in this province who is going to benefit from any piece of legislation is very simple. It's the same as with this piece of legislation. Our commitment and our intention is to make sure that government provides the resources that are needed to ensure that this bill is a success. Again, I suggest we have a great deal of consultation that is left to do with stakeholders who have been heard from by the government, but perhaps are suggesting now, some are suggesting now, that they may have been heard by the government, but they are not being listened to. And those stakeholders are coming to us and suggesting that we should listen to them, and then we should try and find perhaps some changes. But, Madam Speaker, to forewarn the government to some extent, there are some stakeholders who are suggesting that this piece of legislation is dramatically flawed and just doesn't need changes or amendments, but should be rewritten, Madam Speaker. So, not to say that's exactly the path that we may want to go down, but just to let the government know that that's what's out there and that's what's being said right now about this legislation. Again, Madam Speaker, and I will close my remarks right now on this bill, but again, we have to make sure that those resources are there in any piece of legislation. We have to make it absolutely clear that the resources are there to provide the service, in this case, to those suffering from mental illness in this province, that they can be assured that the government is going to provide them the services that they are guaranteed and that they should receive in this province. Thank you very much, Madam Speaker.
The Honourable Government House Leader.
Thank you, Madam Speaker. I move that we adjourn the debate on Bill 111. Adjournment of Bill 111, the Mental Health Act.
Is it the motion is to adjourn debate on Bill 109? Question? Would all those in favor of the motion say aye? Contrary-minded, nay? The motion is carried. Honourable Government House Leader.
Call Bill number 97, the University College of Cape Breton Act.
Call Bill number 97. The Honourable Member from Cape Breton Nova.
Thank you.
The Honourable Member from Glace Bay.
Thank you, Madam Speaker. Madam Speaker, may I just first of all inquire as to how much time I have left during debate on this particular bill?
46 minutes
I
on
certainly would be willing to take...
I'm sorry, I don't know that. Hold on. "21 minutes.
Thank you, Madam Speaker. Well, when debate did stop yesterday, Madam Speaker, I think that I was pretty well successful in changing most members' minds in the Assembly, that they were at least reconsidering that it would be a bad idea to rename the University College of Cape Breton to Breton University. But of course, Madam Speaker, I jest because most members in this Assembly are at least indicated to me that they are in favor of changing the name to Breton University. Unfortunate, Madam Speaker, very unfortunate, because I continue to receive, some of which I'm going to enter into the record right now, I continue to receive mail and email from everyday Cape Bretoners back home who are indicating that they do not want the name changed to Breton University. They would prefer if Cape Breton was kept in the name of their institution, Madam Speaker. Let me start with one from a person by the name of Patrick Dwyer, who has written me an email to say, as a graduate of UCCB and continuing supporter of that institution, I am strongly opposed to the currently suggested name change and want you to know that as one of your constituents, I hope you will consider sending this proposed name change back to UCCB for more decision with the local community, the people who really built the University College of Cape Breton. Send it back to them. The people, I am not opposed to the suggestion of dropping the word college from the name, but the name must contain a reference to Cape Breton. And the letter writer goes on to say, Madam Speaker, that he feels this is a cheap marketing ploy to make people think we are something other than what we are, and that the University College of Cape Breton should be above this type of spin doctoring. And Mr. Dwyer says we need to show our pride in our community and in our educational institutions, and I will be watching this debate closely and hope you will support the locally organized protest to the name change. Well, Mr. Dwyer already knows, and perhaps knew before he wrote me this email, that I am opposed to the name change at the University College of Cape Breton, and certainly we're watching it very closely, and we'll do with what we can. We'll do what we can, Madam Speaker, to try and... I have vowed to fight this name change, and indeed I will, Madam Speaker. Let me give you another. This is from a letter to the Cape Breton Post, which I would suggest was written somewhat tongue-in-cheek by a man by the name of Sean Howard of Manadoo. And the writer goes on to say, as a devoted reader of the Cape Breton Post, I write with a modest proposal to boost your image, transform your brand appeal, and increase your circulation. Simply rename yourselves the Breton Post. An abbreviation as simple as it is sexy, as marketable as it is meaningless, and before you can say, hey, presto, new readers will come flocking. Indeed, we can expect, as the member for Cape Breton Nova suggests, it was the Post record. Yes, back in the 30s, Madam Speaker. Indeed, we can expect a steady influx of new residents from Canada and around the world anxious to enjoy the high-quality education afforded by each edition. And for a sweeping new motto, I suggest the past under the carpet, or perhaps under the cape. Madam Speaker, there's as I said, I've got a number of emails here that I'd like to keep reading if I could, Madam Speaker, and these are from people who are opposed. As I mentioned the other day, I did get a few emails from those who were in favor of it, and I'll gladly table those for the record because it wouldn't take too much time to table them. There's only about 3 of them, Madam Speaker, but the rest I'd like to read into the The rest I'd like to read into the record, Madam Speaker. This is one from a person by the name of Jenny McIsaac, Madam Speaker, who said, "I heard your interview on CBC Radio concerning the UCCB name change to Breton University, and I would like to say that I agree with you. I was shocked to hear the name has been changed to Breton University. Case closed. End of story. I feel the board should have looked for input from the entire community before making such a drastic change. With the exception of a small group of people, no one was aware that a new name was being considered for UCCB. And most, like myself, were under the impression the discussion was whether or not to drop the word college." Madam Speaker, the letter writer goes on to say, "If you search the Canadian Association of Universities and Colleges, you will find universities are most often named for the community where they reside. Those begun by religious organizations." Madam Speaker, the NDP will get their chance to stand up and say that they're opposed to this bill and that they don't support the people of Cape Breton. I'll give them the opportunity when my time is up. But until that time, we already had one member of the NDP, the education critic, who stood on his feet and said that he didn't care about supporting the people of Cape Breton. He made it perfectly clear, Madam Speaker.
Order. Honourable member from Cole Harbour Eastern Passage on a point of order.
You know, this is the second time, Madam Speaker, in 2 days sitting in this House where this member from Glace Bay has felt the need to stand up and question our party's support and interest in the people of Cape Breton, when I don't even know where exactly he's even getting these ideas. And I would insist that he please stick to the script, focus on this piece of legislation, and reflect on the fact, again, that every member of this House is committed to every person in this province, and that includes the people of Cape Breton. And we don't need the member from Glace Bay trying to insinuate that some members of this House do not.
Thank you. That wasn't a point of order, but on to the honourable member from Glace Bay.
Well, Madam Speaker, glad to see that the NDP is being supported again by their Tory colleagues. We've seen many, many times in this House how the NDP has propped up this Tory government, and I guess we'll see it again under this bill that proposes to rename the University College of Cape Breton and strip the identity from the university, and therefore do a great deal of damage to the pride of Cape Bretoners, Madam Speaker. Madam Speaker, there has been the only person to stand up for the NDP so far to whine and cry is the House Leader for the NDP. The education critics stood up, Madam Speaker, and said very clearly they didn't support this bill and that I was the one who was whining and crying because I wanted to change the name and keep it the same and not change it to Breton University, Madam Speaker. It's a silly argument, Madam Speaker, one that is left for the end of the day when you have no other ground to stand on, Madam Speaker, I suggest. But anyway, let's move on to the real debate, and let me finish this letter so that Cape Bretoners' voices can be heard in this legislature. And they'll come from this member, Madam Speaker. The letter writer goes on to say that if you search the Canadian Association of Universities and Colleges, you'll find universities are most often named for the community where they reside. And I've searched that registry, and that's the truth. And I suggest for the members who are saying otherwise, search it yourselves, because you'll find that happens to be the case. Those begun by religious organizations were usually called after saints, and those named after a famous individual or founder or benefactor. That's a fact, Madam Speaker. Now, the letter writer goes on to say, without the Cape Breton, it is a meaningless name for our university. I feel that the Board of Governors was misguided by their desire to market the University College of Cape Breton for the readers of Maclean's magazine. UCCB, Madam Speaker, again, if backbenchers over there on the Tory side or the NDP want to have some say on this, please stand on your feet and get on the record. But if you're just going to yap at me, Cape Breton won't really know how you feel about this, Madam Speaker. So until that time...
Order. The honourable honourable member from Kings North.
I was just going to correct a factual error on the Speaker's part. He said that universities started by religious organizations are normally named after saints. Actually, Acadia, Mount Allison, Queen's University. I think if he did, it's mainly Roman Catholic schools that were named after saints. The other schools were named with different names. So I'm just correcting an error on the Speaker's part.
Thank you. The honourable member from Glace Bay.
Thank you, Madam Speaker. The member makes a good point. The member also made a good point when, before the private and local bills of this committee, that there were some 65 presentations that were made from all of the stakeholders involved in Acadia University when they appeared before this legislation on a matter of governance. And we heard from all of the people who were involved, not just from the Board of Governors. We heard from all of the people who were involved in that particular issue at Acadia University. But Madam Speaker, in this so far, everybody seems to be going along with what the Board of Governors is proposing. We had no problem during that time in that debate sending back the matter to Acadia University and not doing anything about it at this legislature, but telling them, hey, get your house in order and handle this on your own. But Madam Speaker, in this case, again, let me finish my letter. In this case, the letter writer says that, in her opinion, the Board of Governors was misguided by the desire to market UCCB for the readers of Maclean's magazine. And she says that the University College of Cape Breton is the most important institution in Cape Breton, not a box of crackers that needs a catchy name. I've had that suggested to me a few times. Are we naming this institution now after a box of crackers, Breton crackers? Isn't it a little ridiculous? Now, she goes on to say that Nova Scotia has the lowest funding in the country for universities. Well, we all know that. And I shudder to think of the money that will be wasted changing the name of the university. We would have to inform people where it is located and convince them that it's not a new university. It has taken the University College of Cape Breton 30 years to get where it is today, on the brink of greatness. Don't let them set us back with an unfamiliar and meaningless name. And that's exactly, well, I couldn't agree more. As you know yourself, I'm going to table all of the letters, Madam Speaker, that have been sent to me, so I certainly will. It will give some of the members of the opposition party, anyway, a chance to actually read what Cape Bretoners are saying, because they're certainly not reflecting the views of what Cape Bretoners are saying, but it will give them the opportunity of saying, hey, away you go. Madam Speaker, again, here's a letter that I'd like to table. This is a letter from a person by the name of Alex McCachran, who has written to the Honourable Jamie Muir, the Minister of Education in this legislature. Dear Sir, it's not often that I write to a Minister of the Crown, but today I feel I must as a matter of honour. Sir, I request that you advise the Board of Governors of the University College of Cape Breton to reconsider the name change of that institution, and my reasons are as follows. Cape Breton waited for many years to have a local university. When we finally did establish a university in the 70s, it was already 50 years overdue. In the early years, Cape Bretoners supported other universities. These universities did a great service for Nova Scotia, and we are proud of them. The problem was that as Cape Bretoners, we had to travel great distances, and this did impact on the overall education of the population. When we were the industrial heart of the Maritimes, our education dollars were going from this community. The letter writer goes on to say, the first institute of higher learning in Cape Breton was in our own East Bay, when a college was set up in 1824 to prepare young men for the priesthood, which lasted for about 4 years. It would be another 30 years before Bishop McKinnon started St. Francis Xavier in Arashat, which he moved to his native Antigonish the following year. We would have to wait another 100 years before St. Francis Xavier set up Xavier College in Sydney in 1951. And that little college produced many fine students who had to move on to other institutions to obtain their degrees. Again, Mr. Alex McCachran says it would be another 20 years before the Minister of Education announced the formation of the University College of Cape Breton. It was a marriage of the Eastern Tech and Xavier College that was to be uniquely Cape Breton. 100 50 years after the little college at East Bay, Cape Breton had the beginnings of a university. We were so proud. Now we had someone to carry the flag and tell our story. Never before had we the opportunity to have explained to us the people, coal, steel, labor, church, radio, flight, and war as it affected us. Now there was an institution of prestigious substance available to research the national sciences of Cape Breton. It is not ironic that in the week the Cape Breton Highlanders Regiment may have held their last reunion, the university drops the words Cape Breton. And Mr. McCachran wraps it up by saying, for those who feel embarrassed or humbled by being Cape Bretoners or of living in Cape Breton, there are many opportunities off-island. In closing, sir, I wish that you would make these concerns known to the House and Board of Governors. Respectfully yours, Alex McCachran, a citizen of Cape Breton, who indeed, Madam Speaker, made sure that there were copies sent of this to the Minister of Energy. There were copies sent to the Minister of Tourism. There were copies sent to MLAs for Cape Breton Centre, for Cape Breton Nova, for Cape Breton South, Cape Breton West, Victoria the Lakes, Richmond, and to myself as the member for Glace Bay. So in other words, Mr. McCachran wanted to make sure that he got the word out, to MLAs who would be debating this. I'm not sure, Madam Speaker, of what year he graduated, although I'm not sure what significance that would have on anything that I'm talking about here right now, Madam Speaker. Another letter writer goes on to say, and his name is Paul Moore, by the way. Paul Moore is a graduate of the Bachelor of Arts and Community Studies at the University College of Cape Breton in 1996 for the member from Kimberley Prospect. Mr. Moore goes on to say, I would like to inform you of my position on the issue of the name change of the University College of Cape Breton, and I will provide some background information to try to help you understand my position. I began at the College of Cape Breton in 1981. I attended the electronic technology program there from 1981 to 1984, at which time I left the college because of declining marks and employment opportunity, he points out. During the time I was enrolled at CCB, I was active in the development of the Technology Society. I believe this was as important as during this period the College of Cape Breton was moving towards degree-granting status, and as a technology student, I felt the institution was seeing technology perhaps as a poor cousin. As a result, many of the activities that were planned revolved around the university timetable, and the technology program was left without. This feeling was confirmed by the Student Union staff advisor, who refused to assist with any aspect of the Technology Society. I returned to the University College of Cape Breton in the early 1990s, this time as a mature student. I enrolled in the community service courses and completed my Bachelor of Arts and Community Studies degree in 1996. I also was awarded the C.W. MacDonald Memorial Award for Leadership and Scholarship. Since completing my degree, I have also completed a BSW degree through UCCB and a Dalhousie partnership. It was through this degree I confirmed my belief what a wonderful, unique, and strong institution we have as compared to other long-standing institutions with poorer student relations. I proudly wear my UCCB ring for all to see. I have accepted a president's appointments to a degree committee and am currently serving with the review committee. I enjoy the opportunity to serve the University College of Cape Breton. Mr. Moore says, I have another family member who also attended Little X. My uncle taught at the Nova Scotia Institute of Technology. I've attended both CCB and UCCB. I'm proud of both aspects of this institution equally. I believe that the historical lineage of the institution, the merger of Little X and the Nova Scotia Institute of Technology, is an important aspect to maintain. I believe that the name is the property of the community. Although the Board of Governors is said to represent the community at large, I believe that changing the name of the institution should be a matter of public debate with input from faculty, staff, alumni, and the greater community at large. I feel this process has not occurred and respectfully request that the final decision on the name change be postponed until public consultation is secured. Madam Speaker, Mr. Moore very eloquently put it in those words in that letter in an email to me, and the same message I'm trying to convey to members of the Legislative Assembly here. The general public, the people that put us in these seats, has not been consulted adequately enough for us to say it's okay to change the name of a great 30-year-old institution to a name which is totally meaningless to the community, Madam Speaker. Totally meaningless. Once the words Cape Breton, both, Cape in particular, because Breton will remain, but once the name is stricken from the name of the University College of Cape Breton, a great deal of pride and history and heritage, his culture has disappeared, Madam Speaker. Thank you very much, Madam Speaker.
The honourable member from Cape Breton Nova.
Thank you, Madam Speaker. As you can just tell by my colleague from Glace Bay, it's quite a heated issue in Cape Breton nowadays, making the talk shows and making the email route. I myself personally, as of today, have received about 11 I'd say 6 emails, and actually some of the ones that my colleague just read, I have them here. And I received some telephone calls, and I've called some people back that have called my office to speak about this, Mr. Speaker. But, Mr. Speaker, as my colleague said, no one was aware. I think I'll remind him that a name change for the institution has been ongoing for several years. In 2002, the Students' Representative Council, the SRC, the highest decision-making body for all students, held a plebiscite, engaged students through about the possibility of the name change. The results were 61.7% of the 845 votes cast in favor of the change. During this year, Mr. Speaker, during the past year, Mr. Harker, Mr. Speaker, has met with the institution departments and centres, and in June, the Board of Governors agreed to review the university's name as departments in overall repositioning efforts, Madam Speaker. Madam Speaker, on September 21st, 2004, the University College of Cape Breton's Board of Governors decided to change the name of the institution from UCCB to Breton University. Representatives from the Student Union, the faculty, the Alumni Association, and the Cape Breton community were involved in the unanimous decision. Breton University was of the 3 options shared with public in June of this year. I spoke recently, as of last week, here in the legislature, the Chancellor, John Harker, about the name change and how important he feels that it is to move along. This year marks the 30th anniversary of the Institute, and we're also welcoming our 2nd Chancellor. We're celebrating 3 decades of accomplishments against all odds and celebrating our growth with the installation of a new Chancellor. These are 2 very important and pivotal events, significantly turning a point in the corner for this institution, Turning the corner. Introducing a name change before embarking on this challenge, symbolic approach. Madam Speaker, Mr. Speaker, as I hear from my colleague from Madam Speaker, Glace Bay, I was about to say Cape Breton East. I apologize for that, Mr. Speaker. Madam Speaker, I spoke to the Student Union representatives, Jamie Crane and Scott Gillard, as of last weekend, and spoke to them again this week. Before I left, I actually had the privilege and the honor of going to the soccer game at the university on Saturday afternoon to see if I could get some feedback, and I watched it. Well, actually, they lost to Acadia 2-1. But it was a great game, and I think that, nevertheless, with Breton in its name, and the sports team will still be called the Capers, a strong association with the place has been maintained. There's not going to be any change with the Capers. The name Breton University strongly represents our pride and our place while helping to position the institution within current and future markets. 98% of the graduates of Glace Bay High School attend University College of Cape Breton, Mr. Speaker. I know this matter is dear to my fellow colleague there, but with the outward migration and declining of population in the university, Madam Speaker, I don't know if they'll ever change the name of Whitney Pier. I guess when I get asked you know. Well, I don't know what I do, Madam Speaker. I really wish. I'm not going to...
Talk about Glace Bay. Talk
Yeah.
about Glace Bay in the high
Madam
school.
Speaker, the Glace Bay High School,
Declining
with
enrollment.
the
It's
declining enrollment in school, we have to come outside our province to bring students in to make this university a viable place, Madam Speaker. Okay, Madam Speaker? No, to give you an example, Madam Speaker, I heard my colleague before, Madam Speaker, talking about many universities. He had said that many universities were named after geological locations. Well, Madam Speaker, a national database of Canadian universities reveals that less than 1 of 5 universities actually have their specific locations embedded in their name. The association with specific place of location is obviously not a concern for the vast majority of Canadian institutions with whom that university must compete with.
That's right. That's right.
So in order for us to bring those people in, Madam Speaker, we need to make a change. Yep. Madam Speaker, I actually have an article here, and I will table this article today in the Chronicle Herald here, where it was mentioned here by John Abbas of Sydney, I guess, that the surrounding can be ready, looking to stop a change from